Good afternoon, it's Dr. McDaniel at GYN Corner. I'm a board-certified obstetrician gynecologist in New York City, Midtown Manhattan, and I'm bringing to you all things health-related for women. Thanks again for joining me here on Facebook Live. I'm also on YouTube. The YouTube channel is called GYN Corner, so check us out there. And the podcast is also called GYN Corner. Please join me on the podcast. We're on 8 different platforms, the most popular being the Apple iTunes, the Google Podcast, the Anchor, and the Spotify. So thanks again. And as I wrote on the presentation, today I'm talking about the air quotes usual or the air quotes normal discharge. So I get that comment a lot. I just got that earlier today. Someone comes in and she says, I think I have an infection, I'm not sure. And I said, well, if you think you have something going on, then you probably do, or you wouldn't have come in if nothing unusual is going on. And I go, so what have you noticed? Do you have like an irritation, an itch, a discomfort? Or they're like, yes, no, maybe. Oh, do you have a discharge? And they go, well, it's just the normal discharge. And I go, well, what do you mean by normal discharge? Well, it's the usual discharge. It's the usual normal discharge. And I go, okay, so it's not normal to have a discharge unless you're ovulating. So discharge is any kind of liquid from the vagina. And it's normal to have, the vagina is what we call a mucous membrane. So it's kind of like, well, I should say it's exactly like the inside of your mouth. It's the cheeks and the inner mouth all the way through the intestines. So if you open your mouth, you will see that the inner cheeks have a moist, glistening, supple appearance or look to them. That's how the vagina should look also. They're the exact same type of tissues, mucous membranes. They should have a moist, supple, kind of a light, thin sheen on them, and that's just from the natural moisture. If there's a discharge, then that's a liquid coming out of the vagina that you can feel. If it's just the normal moisture, glistening pink, normal vaginal mucosa or tissue, it shouldn't be wet and it shouldn't be drippy. Now, it is normal to have a discharge if you're ovulating. We call that discharge a spin barquette. And spin barquette is classically a watery, thin, clear, slightly kind of stretchy or gooey discharge. And it's obviously when you're ovulating. So it should be for, on average, 3 days, occasionally up to 5 days mid-cycle or 2 weeks before your menstrual cycle. And it's a change in the cervical mucus that occurs with the shift in the hormones from ovulation, the estrogen shift. Otherwise, the cervix has a thicker plug, so there's nothing flowing out of the cervix. And the vaginal tissues themselves, if they're in a normal balance, they shouldn't have a discharge. Now, I've gotten that comment a lot over the years that it's their normal, usual discharge, and I have to tell patients it's only normal for everyone to have a discharge when they're ovulating. Now, some women will always have a discharge, and it can be either a pathologic or a non-pathologic discharge. A non-pathologic discharge, we call that a physiologic leukorrhea. So it means that individual person responds to the normal pH and the normal biome or microbiology that's present in the vagina with a slight shift. It's nothing that we can pick up on the cultures, and the culture will say she has a problem. The pH is always within normal limits, but it's just enough of a shift where she always has a discharge. And that physiologic discharge is usually a watery, slightly clumpy, clear to cloudy, slightly white tinged discharge. Now, for others, it's not a physiologic discharge. Their air quotes normal discharge is always represents a slight imbalance. So they always have a slight bacterial shift or a slight yeast presence. So if I take a look on the evaluation, it always looks like they have a bacterial overgrowth, or they always have a yeast overgrowth. I'll do a pH strip and it'll always be a little bit off. There's always a pH shift, and that allows for the normal bacteria that should be in the vagina to always be at a slightly elevated level. So they have a heavier amount of bacterial concentration than the average woman is supposed to have. Of course, realistically, that's not a health issue. It can be an annoyance because no one wants to always have to wear panty liner, panty shield, or change their underwear all the time because they're dripping and they're wet. That's not normal, but for that individual, it may be normal. Now, a while back, I went on the internet because people tell me, oh, well, I did a Google search. They said it's normal to have a discharge. And I'm thinking, who's telling people it's normal to have a discharge every day of the month? So I looked it in, normal discharge, and sure enough, this is why you can't believe everything you read. Sure enough, first page I go to, it says it's normal for women to have a discharge every day. That's not true. It's not true. I see a lot of patients. First of all, personally speaking, I don't have a discharge every day. Might be TMI, but that's the reality. And I see patients every day. It's not just me. I do vaginal exams. Almost every single patient wants an exam for something or another. And I'm looking in vaginas all day. And if they're not coming here for a problem, they're coming in for maybe pain sometimes, or they're coming in for a bump or a growth, or they felt something in the vagina, or it's a routine annual. I'm going to say 80% of the time when I do an exam, there isn't any discharge. It's just a normal pink glistening vaginal mucosa. So I don't know why people are putting like their authoritative references on the internet that it's normal to have a discharge every day, because it's not. So for the average vagina walking around the world, you're not supposed to have a discharge every day. For about 20% of women, they will have a discharge every day. It won't be the ovulation, the Spen-Bark-Heat, but it'll be because they have, for themselves, they have a slight pH shift, or they have a slight bacterial concentration imbalance. That's not a health issue, so they don't need to try to run and chase and treat it. But for them, it's always a physiologic leukorrhea, or it's a slight imbalance that causes a discharge, but it's not a health problem. Now, over the years, I've had women tell me, okay, it doesn't respond to treatments because they'll do a treatment, they'll feel better for maybe 2 or 3 days. So if it looks yeasty, I'll write them for an antifungal, anti-yeast medicine. If it looks bacterial, I'll write them for an antibiotic, a treatment for it. But the upshot is, usually what will happen is they'll say they felt great, it got cleared up, the discharge went away, they felt totally normal, and then maybe 3 to 5 days later, they start seeing the discharge come back. So in those circumstances, what I tell them is it's not going to be worth constantly trying to chase and treat this imbalance, because it's not a health issue. They're going to be better off taking supplements to strengthen their immune system. And if they take supplements to strengthen their immune system, that will help to balance out the normal flora, the normal bacterial, yeast, fungal agents. And when they balance out that flora and bacterial elements, I told Sabrina a long time ago, sorry, I'm speaking to the medical assistants, if they take the supplements, that will strengthen their immune system. And anytime there's an imbalance, it's a battle between your immune system and your environment. Either a good stress, bad stress due from the environment, or a change in activities, a change in diet, a change in climate or temperature, and then your immune system is responsible for maintaining the normal bacterial levels, the normal pH. So if you take supplements for the immune system, and I always feel the best supplement is L-lysine, 500 milligrams in the morning, 500 milligrams in the evening, every day for at least a 6-month block of time. you will notice a decrease in that discharge, be it physiologic leukorrhea or a slight shift off of normal. So I hope that's been helpful on what is air quotes normal or air quotes usual discharge. So this is Dr. McDaniel at GYN Corner. Please click the subscribe button or the follow button to get the heads up, to get the notifications on the presentations, what the topic is when I'm presenting them. And then please check out the podcast and the YouTube GYN Corner. That makes it really easy because everything's nicely categorized and labeled, and you can just go to whatever you decide you want to check out. Thanks again for joining me. Have a great rest of your Thursday, and I'll be back tomorrow. Bye.